Welcome to the Fertility Show's Let's All Talk Bitesize. I'm Sophie, your host for today, and the aim of this Bitesize event is to help people facing the struggle with fertility get some clear advice and information from our experts. And this particular session is to help you keep healthy and be in the best possible form to prepare for fertility treatment and for pregnancy. I'm Sophie, a fertility patient myself. I'm a journalist, creator of the fertility podcast, The Long Road to Baby, and an ambassador of Peanut app. Now, Peanut has partnered with us for these events, and they are a social networking app for women who are trying to conceive, and it introduces you to women that are facing the same thing as you, so you can get guidance, help and support each other in your very own community. We're also brought to you in association with Fertility Fest and Fertility Network UK. And most importantly, this series of Let's All Talk webinars is being brought to you completely free of charge by the Fertility Show. Now, the Fertility Show is an essential event for your fertility journey, bringing you a whole year of expertise and advice for you to tap into. From these free talks to our virtual summit, which is running between the 24th and the 27th of September. If you haven't got your tickets yet, I would urge you to do that. We're going to be bringing you a host of exhibitors, clinicians, and expertise from across the world of fertility, all at the click of a button, including my guest today, who is Dr. Marilyn Glenville. Welcome, Marilyn, to this conversation this afternoon. Thank you for joining us. It's really good to have you.
Yeah, really glad to be able to talk about this, especially, in a bite-sized form, really, able to explain and share that information with everybody.
Do you mind telling us a bit about yourself before we start my questions, please, Marilyn?
Well, I'm a nutritionist and I have a particular passion and speciality in women's hormone health and also fertility. So I've been in the field now for over 35 years, usually have clinics in Harley Street, Kent and also Ireland, but I've been working remotely for almost over a year now. But we look after women who are, and of course men who are aiming to conceive naturally, want to improve the success rate of IVF or prevent miscarriages, but also look after women with polycystic ovary syndrome, fibroids, endometriosis, really any hormonal situation where nutrition can be used alongside the medical treatments as an add-on, or instead of, if they need some, strong dietary intervention.
Brilliant. So I'm going to ask you 5 questions now. And if you don't mind giving us your answers, and I'm going to start. So it's very easy, really. Question 1, what would you suggest is the best diet for fertility then, Marilyn, for somebody starting out?
Well, it's interesting, Sophie, because we all think of the Mediterranean diet as good in terms of cardiovascular disease, cancer, everything else, but they also have looked at it with fertility as well, in terms of couples going through IVF and ICSI, and those following the Mediterranean diet had a 40% increased probability of pregnancy. So really important to get that diet right in terms of both the man and the woman. It will be the same for natural conception as it is for IVF or ICSI. It's just hard with diet because we eat so many different things. So most of the clinical trials and the information is actually done on a nutrient, for instance, zinc versus a placebo, because it's easier to control. Much harder to see what's going on with diet and fertility because we're eating so many different foods. But the emphasis seems to be on eating a rainbow, that we're getting all of these antioxidants in our diet. I know our mothers talked about eating our greens, but we've gone a step further now into eating a rainbow. And that's the same both for men and women. It's getting those antioxidants in the diet as well as other nutrients that are important. But it's thinking about the brightly coloured fruit and veg and getting as much of those as possible in our food.
Can we name a few of those? I'm obviously instantly seeing tomatoes.
Yes, yeah.
That's obvious. What else apart from tomatoes then?
And you're thinking of carrots, you're thinking of berries, you're thinking of beetroot. Yes, all the greens like broccoli, even the white like cauliflower. Each of those, when it's got a different coloured pigment, that carries different antioxidants. So like your tomatoes would carry lycopene, carrots would carry beta carotene. So it's having that variety of those different colours is really important. And if we can have a few of those every day, that would be really, really beneficial in terms of fertility.
I was going to say how much of this though, because how much of these nutrients does one portion carry, or should we be having 5 or 10 or?
I think if we can do the 5 a day fruit and veg like's recommended, it's not always easy to know how much of the nutrients are in each of those fruit and veg. And that's why, I need to use nutrients separately, like in supplement form, because, food may travel hundreds of miles from a country different away, hundreds of miles away, then into a warehouse for days before it gets on the supermarket shelf. So there will always be that depletion in the food. So it's trying to do the best we can, and then for fertility particularly, topping it up with specific nutrients that we know from the medical research are really important for fertility,
which we will go into.
Yeah, and it's just doing the best we can with food. I mean, this time of year, salads would be really good. Soups are a good way to get a lot of those brightly coloured vegetables in, because they could all be blended together, and smoothies. So it's just different ways of trying to get as much of those different varieties of fruit and veg in our diet.
And what about growing your own? Surely that's a great option.
Oh yeah, that would be the best option. And of course it could be organic as well. And that could be really helpful. It's not only that the nutrient density could be better, but also there won't be residues of any pesticides on there, which particularly for women could have what we call an endocrine disrupting effect. They could have an effect on our hormones as women because of the pesticide residues. So going for organic, obviously growing your own, you've got the nutrients there so quickly from your own garden or plot to your kitchen, so there isn't going to be that loss of the nutrients, and that would be absolutely amazing to do that.
Brilliant. Thank you. Question 2 from me: can we improve our own fertility, and how long does it take to do so?
Yes, we can. And I know a lot of women may be worried because they may have done an IVF cycle and they've told they've got old eggs because they may be in an older age category. And I know as women, we're born with that ovarian reserve. So we have that set egg store. So there is the feeling that we can't do very much. But what's really interesting, and from the research, we know that it takes 3 months for a woman to mature that egg that's going to be released to ovulation. And all they're doing with IVF is getting more of those eggs to be dominant so they can collect them. So we know already that it takes men 3 months to mature and produce a new batch of sperm. So with men, we can change both the quality and the quantity of the sperm. With women, we can change the quality. We can't change the quantity because of that egg store being already there. But women may not realize that in that 3 month, we've got a window of opportunity where we can actually improve the egg quality, either for natural conception or ready to go ahead for an IVF or after a failed IVF. So it's them thinking about, actually, there is some potential. There's something they can actually do to improve the egg quality that can make a difference alongside what they're doing, with their partner or the sperm side of it. So it is thinking about improving that egg quality to make a difference either for natural conception or for IVF.
And is that for women of any age? Because of course we know that as we get older, those eggs not just deplete in quality, but quantity and quality. So can we improve them even at the age of 40?
So my feeling is that as long as a woman's ovulating and she's got some egg store there, we can improve the quality. So yes, it's not going to be the same as when she was 20 years old, but there's always that possibility of improving the quality. And that's really important, especially if you've had a number of failed IVFs or repeated miscarriage. It's thinking about what can we do to improve that egg quality that gives her a better chance. And for me, there's nothing to lose by doing this. Everything's going to be a benefit in terms of getting nutrition right for your general health anyway, but also it means setting yourself up for the pregnancy so that you're in really good health as the pregnancy starts as well. So none of it is wasted. It's just getting yourself in really good health, but improving both egg quality, but also with the sperm, it's possible to produce or improve quality and quantity.
And is there anything we should be avoiding? as well, because we haven't discussed that. Foods that we should have, I mean, we know that alcohol and cigarettes and stress, etc., and that's a hard one, isn't it? Stress. But is there anything that we should physically be avoiding?
I would say yes, and I would think of it as, when we think of nourishing our body, we're nourishing every cell, and of course that includes egg and sperm as well. So I would be careful of processed foods, artificial colours, sweeteners, things like that are in a sense chemicals, and keeping the diet not just as clean as possible, but obviously a good variety of food, but thinking of it as more whole foods and taking away those things that in a sense are artificial. I'd also be careful of things like added sugar as well. That has a big hormonal effect for women, especially if they've got polycystic ovary syndrome, and thinking more of reducing how much added sugar is actually going into the diet or in the foods that they may be already buying, because it has a big impact on hormones generally and health. So that would be one of the big ones to avoid. For some women, caffeine may be having an impact. It might either delay conception, suggesting some of the research, or increase the risk of miscarriage. It's not going to be the same for every woman, but there may be an effect for some. So it may be looking at what's already gone on for that woman, whether it's better to take out the caffeine completely.
Thank you so much for that. Question 3 is, what would you say are the most important nutrients for both men and women in fertility?
So we talked about the antioxidants, which we are getting from our sort of eating our rainbow. And then we're thinking of the specific nutrients that make up those antioxidants, and think like zinc, selenium. And actually zinc is the most important one for fertility, particularly for men, but also women. But we're also thinking of things like vitamin C, vitamin E. All of those are really powerful antioxidant, also coenzyme Q10. So we have a lot of possibility of actually using extra nutrients on top of a good diet if the woman already knows that maybe there's an issue with egg quality, or she's in the older age group, or a man has found out he's got abnormal sperm. So it's knowing something, that may be already there in the medical history, that maybe those extra nutrients are going to be really important and really powerful. And just to give an example, there's been studies with zinc and folic acid on men, 74% increase in sperm count. Another one was vitamins E and C combined, given to men after one failed ICSI treatment, and they got a nearly 50% pregnancy rate with those two antioxidants in, compared to only just 7% in the men who weren't taking them. We've looked at Q10 in the medical literature, improves egg quality, also vitamins C and E, and also helps with the womb lining. Vitamin C also helps improve progesterone and lowers FSH. So we have this wealth of information in the medical literature about how these specific nutrients can impact fertility, both for men and women. And that's really useful to know.
And how do we get these? Can we just go to Boots over the counter, or do we have to go to a specialist to get these drugs?
Yeah, I think because they're going for IVF, which obviously is private and does cost quite a bit of money, the investment in terms of the quality of the nutrients is really important. You do get what you pay for supplements, and the form of the nutrients is important. I formulated a range of supplements for the natural health practice, specifically because I wanted certain combinations of fertility supplements that I didn't think were available on the market, and that they were in the most active and bioavailable form. So that's what we use in particularly for fertility, to have something that's more specific for fertility rather than just an antenatal. That's where I've chosen those nutrients and taken them from the medical research. So really important to use the evidence that we have, and then to be able to use that in clinical practice.
I see. Okay. And so I'm guessing that buying them over the counter isn't almost good enough. Is that what you're saying?
Yes, I mean, they can get the natural health practice one from the website. It's naturalhealthpractice.com. I would just suggest that they choose the best quality they can, and they may seem a little more expensive than others, but it changes the absorption, it changes how much of that nutrient is in there. You've got to look at, say, how much zinc is in there. That's really important. It's not just the list of nutrients, it's how much of each that makes it impact fertility, rather than a general multivitamin and mineral that somebody would use just for their health, which is good, but it's not focused on fertility, which is what we're after for men and women who are going through this fertility journey.
Thank you. Let's move on to tests now, because I didn't realise this until now, but you can actually do nutritional testing.
Yes.
So what is a nutritional test, first of all, and also what are the most important tests for fertility?
Yeah, so in the clinic, we would do a blood draw. So they'd go to a lab, have their blood taken, and it would measure every vitamin and mineral. So all the B vitamins, vitamin C, vitamin D, the antioxidants like we've talked about, E and C, also all the minerals, and omega-6 and 3. So we'd be looking at where there could be either deficiencies or imbalances to actually get somebody in the best of health, ready for either natural conception if they're struggling a bit with that, or to prepare for an IVF treatment, particularly if a number of those treatments have failed. So it's thinking about helping somebody correct any deficiencies. And it also means that we can actually really personalize what somebody needs, because we can actually see their deficiencies. And it may be different for the man and the woman. It could be, just changes, small changes that are, fine tuning their supplement program, because we can see clearly what they're lacking and what the body actually needs. So we found it really useful to use those blood tests over the last 30 odd years. Really can make a difference.
Brilliant. Thank you so much. Wow. And so with the tests, can you specifically look, so say for example a man goes in with a really low sperm count, or a woman isn't carrying, like, can you see and check for each individual problem that people have?
We can check where we think there may be a problem, and obviously certain nutrients are going to make a difference in terms of certain issues. So for instance, if a man's got a lot of abnormal sperm, or maybe also the motility isn't good, in my head I'm immediately thinking of coenzyme Q10 and the other antioxidants as well. And out of all the tests we do, there are two, I would say, that are the most important. If somebody doesn't want to or can't have all of the tests done, there are two that I think stand out, and they are both important for men and women. One of them would be omega-3 and also omega-6. The two are measured together. So when we think of omega-3, they're anti-inflammatory. We get them from oily fish, we get them from things like flaxseed oil as well. And we do know they're really important for blood flow to the baby. So like you said, if a woman finds out that maybe a pregnancy isn't continuing, we're thinking, is there an issue with blood flow? There are some women who have a problem called antiphospholipid syndrome, and that's been shown in the medical literature to make a real difference by using omega-3 supplements, even if they're taking things like heparin and aspirin. But it's that ratio of omega-6 to 3 that's really important, because omega-6 produces more inflammation, and we don't want that inflammatory response. And even for men, it helps improve sperm count, also motility, and also number of normal sperm as well. And really interesting research that after only 1 month of the omega-3, there was a significant reduction in FSH. And if the women have too much omega-6, it actually creates poor egg quality. It has to be good amounts of omega-3. So it's one of those tests that are really important generally for our general health, but really come into their own for fertility, both for men and women. And when we think of inflammation, anybody who's got a condition with an ITIS on it, like arthritis, diverticulitis, colitis, any of that, that's an inflammatory condition. And that's when a bell would ring for me to think we need to find out what their level of omega-3 is, and that's really important.
Thank you so much. And what about something like recurrent miscarriage? What would you do in that situation? What
and then
would you be lacking?
And then it would be finding out, how did that miscarriage happen? Was it due to maybe a hormone problem because they bled, or was it actually due to the baby not developing or continuing? And then we're thinking that of that blood flow to the baby as well. But also things like the antioxidants can help improve the levels of progesterone, which is the hormone that's going to maintain that pregnancy for the first 12 weeks until the placenta takes over. But good research on vitamin E improving the womb lining, so the endometrial thickness, which for some women, they might find out when they go for an IVF that they've got a thin womb lining, which makes implantation difficult, either for natural conception or IVF. And the other standout nutrient that I think everybody should get tested, as well as the omega-3 and 6, is vitamin D. And why it comes into its own in pregnancy is that there are many women who find out they've got a problem with their immune system. And it's an immune system that's actually not allowing them to get pregnant and stay pregnant. So as women, we've got this switch which suppresses our immune system to hold on to DNA that is foreign. So whether it's coming from a partner or a sperm donor, it's foreign. And normally our body, if something foreign is coming in, it's got to reject it. But we have this ability to suppress that reaction in order to get pregnant and stay pregnant. And vitamin D is what's called an immune modulator. It helps balance the immune function. It can bring it up if it's too low, which is important in terms of making sure our immune function is good, but it brings it down if it's too high. And the research has shown that it helps this suppressor, what we call Th2 response, in order to help that woman get pregnant and stay pregnant. So it's really important if there's a history of miscarriage, failed IVF treatment. I know it sounds simple, but it is really important to check vitamin D. And we've just been astonished in the clinic how low people's levels are. And then, of course, in pregnancy, we're building another skeleton. So vitamin D is crucial all the way through the pregnancy, not just at the point of getting pregnant, but really important. It helps with helping that endometrial thickness as well, and also for men. And low levels, there can be more abnormal sperm, the count can be lower. So it's just as important for men as it is for women. And it seems such a simple thing to test, but our body does not expect to get much from our food. So it's not something we could eat enough of. It comes with that manufacture through the skin with that exposure to sunlight. And it's surprising, particularly with women, how low the levels are because of sunscreen, staying out the sun, skin color, things like that, where the level can be really and extremely low, unfortunately.
Wow, that's really fascinating. I know that the NHS are now saying that everyone should have a tablet of any vitamin. This is the one you have, and that is the vitamin D. I know that. And it's the D3, isn't it? It's not just the D.
Yeah, and people need to read the label. D3 is 87% more effective in raising and maintaining vitamin D levels than D2. And even when they've looked at IVF, that couples who've got good levels of vitamin D going through the cycle have a much higher pregnancy rate. So it is really important. And both of those, the omega-3 one and the vitamin D, can be done with a simple finger prick test. They don't have to be done even with a complete blood draw, which we do use when we're testing every vitamin and mineral. But the other two can be simply done with a finger prick test where the blood is collected at home and then sent to the lab. But out of everything we test nutritionally, they would be the most important. We can test digestive function. We can do a lot of different nutritional testing, or even stress. We can do an adrenal stress test. But when we think of what would have the biggest impact on fertility, I have to say the omega-3 and 6 ratio and vitamin D really stand out from the research in the medical literature.
Thank you. One final one from me before we let you go, Marilyn. What would you say to people who are finding it hard right now to get pregnant? and that they're feeling helpless, what words of advice nutritionally would you give to them?
Yes, I know that can be really frustrating. And I would say, I mean, you're very welcome to get in touch at glenvillenutrition.com if you need any advice, and happy to, if you've got any results, you can send them in and we're happy to talk through them. Yes, you might need a consultation, but you might just need some simple tweaks to what you're doing. But I think if you can also think about what's going on with your food as well and put in certain key nutrients, you're aiming to give yourself the best chance of either natural conception or planning whatever you want for IVF. And to think in your mind that whatever you do, none of it is wasted. That yes, you know, you might need a bit of help in terms of that IVF or ICSI treatment, but whatever you're doing in terms of your general health is going to help you cope better. You'll feel less stressed generally, so mentally. And we've got this real connection between the mind and body, and sometimes that gets forgotten. So when you nourish yourself physically, you're also nourishing yourself mentally. It can help you cope. Your decision making is easier. It doesn't feel so overwhelming. And what you eat can actually change the neurotransmitters in your brain, like improving things like serotonin, that feel good neurotransmitter. So it is thinking about this really strong connection between mind and body. And yes, you know, you are going through that fertility journey, but it's also thinking about your health generally and keeping yourself well emotionally and physically, and then also with that giving yourself the best chance of whichever stage you are on this journey, but always happy to help if you need any advice or what step you might need to do next. So we're very good with that if you need help with what direction you should be taking. So we'd happy to help with that.
Thank you very, very much for giving your time up this afternoon. Thank you. A final few things before we go, guys. Please follow us on Facebook, Twitter, and Instagram, all the social places, at The Fertility Show to get the latest information about what we're up to. In particular, our virtual summit in September that's coming to you on the 24th to the 27th, which we're delighted to say Marilyn will be a part of. So if you want to speak to her or ask anyone any questions and hear all their wealth of knowledge and advice, and just so many great fertility people there, get your tickets now. The information is all on our socials or at thefertilitysummit.com, and also download the Peanut app for free and join the Fertility Show group on there. That's where you'll find a discount code to buy your summit tickets. Thanks for watching, everybody. Take care. Goodbye.